Hey, my name's Kate. This video feels a bit vulnerable to make. I don't know if you've ever been in a situation where you felt like a downer or a killjoy or a wet blanket, but it's not my favorite feeling. There's a part of me that would much rather be a part of the thank God the pandemic is over crowd, but that just wouldn't be true. The process of going back to campus has been a complicated one for many staff and students with disabilities at George Brown College. Being on campus is amazing in a lot of ways, but for people who are immunocompromised, who have health conditions or other kinds of vulnerability, it's also dangerous. But it doesn't have to be that way. One thing that would change this reality is if we all took one or two more steps to create safety, support, and solidarity on campus. So thank you for taking the time to learn about what you and we can do to keep our school spaces safe during the COVID-19 pandemic. If you take away one thing from this video, I hope it's this. Wearing a mask tells staff and students with disabilities, people like me, you belong here. You matter here. Your safety matters. Your education matters. When everybody is wearing a mask, everybody can have a place in school. That's simple, but I know it can also feel complicated. Some people can't wear a mask for medical reasons. And if that's you, I hope this video still has some useful information in it for you. I don't want this to feel at all like a guilt trip, but rather an invitation. I think that free, open access to information about our lives and bodies is an important part of making informed decisions about our health. But lately, we haven't been receiving very much useful information from the people who make rules about our lives. It's possible that you don't feel up to date on the science of the virus, or maybe you're just tired of thinking about COVID. I know I am. I hope this video will help you feel more confident when it comes to some of the more recent science around how COVID transmits and how to mitigate its risks. Even when we're no longer mandated to engage in practices that protect each other during a pandemic, we don't need to give up on our commitment to be in this together. We have what we need to keep each other safe. When we mask up, we save lives. I want to acknowledge that many people have hit an emotional wall when it comes to hearing new information about COVID. This pandemic has caused a lot of trauma, and this leads many people to shut down or turn away when they're asked to think about the virus. If you notice that happening for you while you're watching this video, I hope you can extend some compassion to that part of yourself. If not, know that I have compassion for you. If you need to take a break and tend to your feelings at any point, there's time for that. Just hit pause and come back again later. There's still a lot that we don't know about the long-term impacts of the COVID pandemic on our bodies and on our society. But one thing that is different from what we were experiencing in the beginning of the pandemic is that there are a lot of things we do know now. In 2020, we didn't really know anything about the COVID virus, and so many of us were out here with makeshift bandanas on our faces, washing our groceries. So I want to take a bit of time to talk about the things that we know for sure. The first is that COVID is airborne. We know that the biggest way that COVID travels is through the air. We stopped washing our groceries because we learned that it isn't really common to get COVID just from touching surfaces. Since COVID travels primarily through the air, we now really know that masks are one of the simplest, cheapest, most effective ways that individuals can prevent the transmission of COVID, as well as many other viruses. Science about COVID transmission tells us that while masks don't guarantee 100% safety, they do reduce risk significantly. How much they reduce risk depends on the quality of the mask you're wearing and its fit. Well-fitting surgical masks, N95s, and KN95s are our best option to protect against more recent strains of the virus. Luckily, George Brown College provides surgical masks for free all throughout campus. Back in 2021, we heard a strong message from the government that COVID vaccines were going to stop the pandemic. I know when I got vaccinated for the first time, it felt like hope, like maybe this thing was going to end. And then Omicron happened. And we learned that the vaccines we were given weren't going to give us the same level of protection as we thought. So if you're vaccinated, boosted, all of those things, that's awesome. Vaccines do matter, but they aren't everything. That doesn't have to be a doom and gloom message. We just know now that one single thing isn't going to come and save the day. It's clear that we need to use the Swiss cheese method of pandemic management. multiple layers of protection, including vaccines, masks, ventilation, symptom monitoring, staying home when you're sick, good policies and strong investments in the healthcare system, regular testing, and more. That's what we need to end the pandemic and to stay safer while it's still happening. The third thing we know is that masking is not just a personal choice. The message we've been hearing over the last little while is that if you as an individual want to avoid getting COVID, then you are welcome to wear a mask to protect yourself. But that's not really how masking works. We know that masks are way more effective when many people are wearing them. This mostly has to do with just how much potential virus ends up in the air in any given time period. Let's just say for the sake of an example that everybody's mask is 50% effective and that there are no other factors influencing the rates of viral transmission. In this scenario, let's say there's one person with COVID who we'll call the contagious person, and another person without COVID who we'll call the susceptible person. A 50% effective mask means that if I'm the contagious person, wearing this mask cuts in half the chance that I'll infect the nearby susceptible person. Or if I'm the susceptible person, wearing the mask cuts in half the chance that I'll become infected. In this scenario, if neither the contagious nor the susceptible person are wearing masks, it's pretty darn likely that the susceptible person is going to get COVID that day. If the contagious person is wearing a mask to protect others and the susceptible person is not, the chances that the susceptible person will get COVID are now 50% lower because of that mask. If the susceptible person is wearing a mask to protect themselves and the contagious person is not, the chances that they will get COVID are also 50% lower. But if both the contagious person and the vulnerable person are wearing their masks, the chances that COVID will get transmitted that day goes down to 25%. Math. Two-way masking wearing reduces the risk of transmitting the virus significantly. And that number goes down even further when we're all wearing higher quality masks. While cloth masks lower our risk of testing positive for COVID around 56%, surgical masks lower our odds to closer to 66%, and an N95 or a KN95 is closer to 83%. So mask wearing can't guarantee perfect safety, but spending time in a classroom, office, hallway, or community space full of masked people, even if one of those people has COVID, it can be a lower risk activity. But the fewer people who wear masks, the more risk there is. If there are 5 unmasked people who are contagious in a classroom and one susceptible person with a mask on, that person's mask is working hard and alone. And there's statistically a much higher chance that COVID will get transmitted in that classroom. But the more people who mask up, the lower the chances are that a new person will get COVID that day. There's one more thing about this. Research shows that masks are much more effective in stopping us from exhaling the virus than from inhaling it, which means masking is actually much more about protecting others than protecting yourself. That means masking is not just a personal choice, only about your own risk tolerance. It's a choice that impacts everybody. Being the only masked person in a room full of unmasked people, it does make some difference, but not nearly as much as if everybody else pitched in. But aren't we overreacting here? COVID is not that big a deal if you're healthy, right? You might think that because you've had COVID already, maybe multiple times, and it wasn't actually that bad, kind of like a cold. Unfortunately, there's more to consider here. COVID hasn't stopped being dangerous. And this is especially true for chronically ill people, people over the age of 50, and more evidence suggests people who have had COVID before, once or multiple times. Multiple years into the pandemic, that last category has a lot of people in it. As many as 1 in 5 COVID cases may lead to long COVID. Long COVID can look like severe fatigue and brain fog, heart issues, immune issues, and more. There's no definite relationship between how bad you felt when you had COVID and your likelihood of developing long COVID. So you could have gotten sick, had a relatively easy time of it, and still now have a long-term disability. There's strong evidence showing that many people who were recently infected with COVID are immunocompromised now, and so at a higher risk of infection and death from other illnesses like RSV and the flu. There's also increasing evidence that even mild COVID can lead to long-term cardiac issues. And the more times you become reinfected, the more chances there are for things to go wrong. Reinfection is something we really want to avoid. There are many people out there saying that if we really want to keep our community safe, we should act like everybody who has had COVID is now immunocompromised. If we took that seriously, how would we all choose to act? Okay, so I know now that masking reduces my likelihood of giving COVID to somebody else, and that this matters because COVID can really hurt people even when they're healthy. That just means I should wear a mask when I'm within 6 feet of other people, right? Unfortunately, not. After lots of new research, we now know that COVID is an aerosol virus. So picture this. Rather than exclusively imagining people spraying COVID all over each other when they talk, sneeze, cough, etc., like we were thinking about it early in the pandemic, we should imagine the COVID we exhale as staying suspended in the air, sometimes for hours. We should imagine it wafting around like a weird little cloud, and also accumulating in the air if there isn't proper ventilation. This is really important to understand because it means that if I am COVID positive and not wearing a mask, I can give COVID to other people who I never even shared a room with, so long as they walk through the air that I breathed into not long after I left. Okay, so this means I just need to make sure I wear a mask or stay home if I don't feel well, right? If I have a sore throat, a fever, or runny nose. I wish that was true. What is true is that it's estimated that at least 50% or more of transmissions are from people who haven't developed symptoms yet or maybe never will. Though this varies based on your vaccination status, we tend to be most contagious during the earliest days of our illness, and often during those days, we're totally symptom-free. Some people never test positive on a rapid test, even when they feel terrible. This is perhaps the most important reason why it's important to promote mask wearing as a culture, because we often just don't know that we have COVID. We often don't know when we're putting other people at risk. We often don't know when our unmasked presence in class, in community spaces, in the hallways and bathrooms might make campus dangerous for others. I don't want to take a risk like that. And so I make masking my default when I'm indoors, in public places where people are meeting their needs, finding joy, pursuing their goals, coming to work. That's the commitment I make to my community, to the little kids in my life, to my partner who has a heart condition, and the elderly folks who I pass in the grocery store, and also to my own right to a safe working environment as somebody who is immunocompromised even before COVID. And I hate talking about this. It's the worst. I have said unfortunately not too many times to count in this video, and there is a lot that is unfortunate, to put it mildly, about living through a global pandemic. Nobody likes to be the bearer of bad news, the burster of bubbles, the wet blanket at the party. But it's important that we know these things. The pandemic isn't over, but there are some things that we are fortunate to have. We are fortunate to have good information about how COVID transmits, which we didn't have 2 years ago. We are fortunate to have languages and policies in place already that help us name this as an equity issue, an accessibility issue, a workplace health and safety issue. We are fortunate to have 2 years of experience saying, we're in this together, knowing that we impact each other, we are connected to each other. And even when the world feels like it's falling apart, we can still care for each other. That memory isn't so long ago, and we can bring it back if we take care not to lose its lessons. So what can help us change our habits around masking? The first is to make situation-specific habits. It's okay to choose to mask in some places like campus, even if you're not masking in others. The more you make an intentional plan about which situations warrant a mask, the easier you'll find navigating the complexities. Help your mask fit well and comfortably. You can tie little knots in the ear loops to help your mask fit more snugly. You can buy or make ear savers that keep your mask from digging in to the backs of your ears, or find masks that go over the back of your head or keep your glasses from fogging up. One thing to pay attention to is if you can feel your breath coming out the sides of your mask, it doesn't fit well enough. There are lots of different types and brands of mask out there, so if one doesn't work for you, you can try another. And remember that GBC provides free surgical masks in many areas of the building. Give yourself some time to get used to it. I know when I started anticipating going back to work in person, I was really worried that I would find going to work physically exhausting because of my mask. I was worried that students wouldn't be able to understand me, or that they wouldn't be able to read my emotional expression. But after a week or two of learning some new habits, wearing a mask at work feels normal now. I go outside to take breaks sometimes, and I remember to pace myself. Just because something feels hard at first doesn't mean it's always going to feel that way. And I know it's harder to wear a mask when other people aren't, but know that when you do, it makes it more possible for others too as well. If many of us make the effort to mask up on campus, campus can be safer for people who physically cannot wear masks, but it has to be a collective effort. It's never too late to change our everyday habits. If what I described in this video doesn't sound like what you've been doing recently, today's a great day to start doing something different. Let's keep talking, and thank you so much again for your time.